Professor Bozdag, it's my greatest pleasure to have you here in Health Information Center Medical Carja. Welcome.
Thank you very much. It's also a good pleasure for me to be in here.
Can you share a little bit about your specialty in the scope of reproductive medicine? Just a little bit more about your experience.
I am working in Koç University. I am the IVF director of Koç University, and I have been working in the area of reproductive medicine and IVF for almost 25 years. My special interest is not only IVF, but also for the other infertility treatments, such as ovulation induction and insemination. Other than infertility treatments, my other special interests are endometriosis, polycystic ovary syndrome, and some gynecological surgeries with endoscopic instruments. So briefly, those are my special interests.
Okay, and can you share a little bit about one of the most interesting cases that you had in your practice? I know that you have a lot of patients and a lot of experience. Can you share something interesting from your experience that you have?
First of all, the most important thing that affects a couple's chance for getting pregnancy is age. So I have to say that briefly, the most important thing is age, and they should be cautious about their chance for getting pregnancy, either with naturally or with some treatments. So if a female age is more than 35, then it might be better to go a little bit early to some physicians who are interested in reproductive medicine and infertility treatments. But if they are older than 40 years old, then it is better to wait just a few months. Then please go to your physician again, which is interested in reproductive medicine and infertility treatments. So mostly people think that IVF is a guarantee method, so they might be wanting to wait for a very long period of time. But when we see our patients, let's say in the ages of 43, 44 and 45, unfortunately we cannot give so many chances even with IVF. So it is better not to wait so much long period of time. But still, they can conceive even in the ages of 43, 44, 45. For example, I had a patient who had at least 12 or 13 embryo transfers and she did not conceive. And in the 14th attempt, she conceived and she delivered successfully. So they should insist their IVF treatments, but it is better to go on in the early ages. So in the more advanced ages, their motivation should be high, because we need more eggs on those ages. So it might be tough to collect enough number of eggs in just with single IVF attempt. So we might need more IVF attempts to have more eggs and more embryos, and to select the best embryo to be transferred. So in early ages, we motivate them, we are so optimistic, but in advanced ages, we need their patience.
Okay, I understand. And what is your advice for the Bulgarian audience? I mean, the Bulgarian couples that need support in this very difficult way this very difficult pathway that they should start walking. What is your advice for them?
Actually, the infertility treatments might be stressful, but they should know that if they are sure about the knowledge of their physicians, and if they are sure about the quality of the IVF lab, then they can expect a good pregnancy rate. But during those procedures, during those IVF procedures, it might be better to be communicating with their physicians, and sometimes it is better to take some help from the psychological departments. So in Koç University, we are maintaining such secondary services for the couples who are having high level of anxiety and stress. So other than regular medical treatment, those issues are also very important. But again, I will say the same thing. If you come in younger ages, we are more optimistic. So please do not be late and do not wait until the late ages. Come as early as you can.
It was my real pleasure to have you here in our office, the Health Information Center, Medical Garage. Thank you very much. Thank you, Professor Bozdag.
It was also a pleasure for me to be in here, and thank you for your all hospitality. Thank you.
Thank you.